Hi, I'm Dr. Bruce Sadlik. I'm visiting today with Amanda Safer. She's a functional medicine consultant, and she's going to help us. We're going to talk a little bit about post-COVID, the long hauler syndrome, it's called. COVID obviously is with us, and there's various methodologies to deal with it. So we'll kind of hit it from both perspectives, keeping yourself healthy, and then also the kind of long journey back. For some patients, it's been very easy to get back if they've had COVID. For other patients I've seen, it tends to be a long struggle back, and hopefully we can help some of those patients and assist them. So first we're going to start talking about vitamin D, and I'll ask Amanda to give us a little bit of feedback on it, and then I'll put some clinical verbiage into it.
Yes. So I love to hear that you were optimizing your patients' vitamin D levels. I think most importantly, when we hear a lot of the patients that end up in the hospital, just reading the data on these patients, their vitamin D levels were so low. So I think most importantly, there's actually a whole website dedicated to COVID and vitamin D studies. You can just literally search it and put COVID-19 and vitamin D. And I think at this point there's 25 different studies that talks about how if you optimize your vitamin D levels with COVID, you can reduce your risk of either contracting or, I hate to say it, but death with contracting the COVID. So I think that that's wonderful that you're absolutely optimizing those levels with these patients, and then figuring out, the best way to dose them once they do, realize, okay, I'm going to have to get some vitamin D on board. Zymogen makes two great products. We have a vitamin D that comes in a 5 or 10,000 milligram form. It's a D3, and then we also have a D3K2 if you need that synergistic effect for your patients. We have two different options for that.
Great. And with the vitamin D, it's helpful to know which level you're at. Mm-hmm. So have your clinician run it.
Yes.
And if you're one of our patients, we usually always try to run those with your every 6 months or yearly labs. And then I'd like to keep a certain ceiling towards it. If we go too high in vitamin D, then we're going to upset the calcium phosphorus balances, etc. So keeping it in the optimal range is really what you need to do, and try to utilize it on a daily basis, and try to get as close as you can to the optimal range of vitamin D. Don't forget, some sunlight can also be helpful. Just obviously don't abuse the sun too much. So the vitamin D is definitely part of it. We were talking a little bit about the vitamin C,
right.
Some options.
Yeah, you've heard that too. That helps with immunity tremendously. Zymogen also makes a great product. It's a buffered vitamin C, so you won't have any stomach issues with it. And then depending on how you'd like to dose them for immunity, that's also a great product that you can add on as well. And then we did talk about the zinc. Mm-hmm. We have a zinc glycinate. It's a 20 milligram. It does not bother the stomach either. It's an albion chelated mineral, so you're getting 90%, over 90% of bioavailability than you would, absorption rates than you would over other minerals that you see at the store. So it's important to know that, if you are going to take these vitamins and minerals, just have it be the highest quality, because then that means it's actually going to work for your patients. I hate to say it, a lot of store-bought products don't tend to be chelated minerals or activated vitamins or whatnot. So in your body, your body might not utilize it or absorb it properly. So if you're going to take something, just make sure it's the highest quality. And I know that, in talking with you, that you see the best success when you use products like Zymogen. You can tell how well they're working by blood work and whatnot, whatever else you're measuring within the patients.
And some of the good blood tests to check with patients are, if you really want to check and optimize your nutraceutical botanicals, is to check several companies, SpectraCell, etc., will provide those tests. And you can see, am I on the right amount of zinc, the right amount of copper ratio to the zinc? Because there's so many different things that are variables with zinc that you want to try your best to make sure everything is kind of fine-tuned and optimized. We talked a little bit about the blend of active nutrients,
yes,
together, and kind of multi-system approach.
Right. So active nutrients is Zymogen's. It's our multivitamin, and it has great assortment of minerals and vitamins in it. It just works synergistically. They call it foundational health. And this is something you could take. You take 2 capsules a day, one in the morning, one in the night, however you see fit. But it really just has like the great, activated B12, the B1, vitamin C, vitamin E, vitamin A, the zinc, a little bit of iodine if you need it. It can come with or without copper and iron, so depending on your patient's needs based on their blood work. But then it's mixed in with a lot of great like nutraceutical adaptogens and that as well. So it's just really foundational health, and you can just feel the difference when you take a vitamin that is, has activated vitamins in it, and it has the chelated minerals. You feel it in your body. You feel differently. You feel like you have more energy. And this is, never to say that this replaces eating, a well-rounded diet, but a lot of us need help. And unless we're going to eat, 7 to 9 servings of vegetables and fruits a day, it can be very hard. So sometimes we do have to supplement. And depending on what you're eating and how great our soil is, like we're getting to the point where sometimes based on the blood work, like we've talked about, supplementation is necessary. So it's nice to know that Zymogen has a foundational formula that's a great multivitamin. That works for my children, 14 and 16, works for me. It works for, anyone across the board. So, and no discomfort, no pain, nothing that happens with a vitamin. You don't taste it. So very well absorbed.
It's very well absorbed. And the nice thing about it is you don't have to take a lot of them. I think it's either some patients I have are taking 1, some are taking 2.
Exactly. Whatever they need.
Some are taking 3. And it seems to work well, especially if someone's on a really excellent diet. They can probably get by a little bit with 1.
Exactly.
Most likely 2, but
and it's wonderful to see that you work with your patients that way.
Yeah.
Exactly.
Dose it according to what's going to work. The last thing we see with the post-COVID syndrome, particularly I see clinically, is the adrenal glands. The adrenal glands, when we have any type of long-term major type of disease and or stressor, because we're not only dealing with the stress of COVID, but we're also dealing with the simple psychological component. And if it affects your employment, affects your economics, then there's so many tiers to being post-COVID syndrome that really can leave you in a tailspin. Proper adrenal supplementation, finding someone you can talk to therapy-wise is critical too. Your dietary, your habitus in terms of your sleep, your exercise, trying to get back into some type of groove can be very helpful. Adrenals, there's a couple ways to take that. What I like to do is figure out what your cycle is. So if you're up, let's say at 6, then I like to say, okay, do 1 or 2 capsules of adrenal, and I'll have you help us out with the various types. But that can help, and then you try to mimic the next phase, which would be around 12 or 1 o'clock. Maybe take another 1 or 2 adrenal supplementation, and try that. Try increasing perhaps a little bit of your sea salts, your mineralocorticoids, and that can be very beneficial, along with your sleep, your exercise, and obviously your anti-inflammatory diet. Can you give us a little bit of background on the adrenals and I know that you personally find it helpful.
Yeah, I can. I can speak to this. I very much have a personal experience with this. So Zymogen makes 3 different types of adrenals. 2 of them have a glandular in it. One has more than the other. But it also comes with the B vitamins for energy, for nervous support, for brain health. It comes with the vitamin C for immunity, and then some beautiful adaptogens like the rhodiola, just things to help you. And when we say adaptogen is adapting to stress. So the reason I am personally on one of these adrenal supplements is because I'm a mother of 2. I run around like crazy. I have, the emotional stress of having my children home from school on computers for school. They're not in school full time, balancing a job. We all have certain things, especially during this time. And I think, Dr. Sedlick hit the nail on the head when he said that we have a lot of different stressors right now, keeping ourselves healthy. So for me, the reason I went on Adrenals is because by 4 o'clock in the day, I was completely crashing. My adrenals were really low, my cortisol level just off. So when I take the Adrenals a little bit before I'm going to have that crash, I start to feel like my body kind of goes back into homeostasis, and I start to feel more energy again, and I just feel more like me. But yeah, it's something to definitely look for to help manage stress, and especially during this time, with the COVID, it's very important.
And we talked a little bit when we first got together today, off camera, about some of this endothelial inflammation.
Mm-hmm.
I know that there's been some studies and some work on trying to reduce this endothelial. And basically what we're talking about is the inside of the blood vessels. So COVID, as you know, does tend to do a few have some wonky things it does to the inside of our blood vessels. So there is some ways to work around it, and the endocalyx was one. As we can see, we got the inside of a blood vessel, and then we have cells and RBCs, and it shows the efficacy of the inside of the blood vessel. And where a lot of this, and one way to measure it is by using simply the blood test CRP, and the inflammatory processing that we get from post-COVID, or really, quite frankly, any type of major post-viral syndrome.
Exactly.
So keeping that down is definitely critical. And you had some thoughts about how it's been working.
Yeah, so what we've learned just from talking to physicians and how they're using this with their COVID long haulers is it tends to be, as we talked about, you're seeing it with the cardiovascular. And so what you really want to do is you want to help deliver like the oxygen, the nutrients, the hormones throughout the cell, and get the blood flow going better within the cell, so you can reduce those cardiovascular events. And then what that does is it pulls out waste from the cells, and it really just helps that glycocalyx, which is that thin shield within the arteries, capillaries, and veins, work smoother, so you have a better blood flow, therefore more energy, and less likely to hopefully not develop those cardiovascular events down the line. So, there's a lot of different indications when you have endothelial, the glycocalyx like dysfunction, and a lot of it could be like cold hands and feet, or hair thinning, mood, high blood pressure. I laughed because I was like, oh, well, that sounds like me. There's so many different ailments that come with this. But when patients started to go on this product, they started to feel their energy improve, and a lot of it is just kind of helping that waste move through the system and getting rid of things that potentially are causing this long hauler syndrome that we're seeing. Not only cardiovascularly, but we talked about neurology, the neurological factors of no taste, no smell.
Exactly.
And just helping keep getting that body of the metabolic waste to get it out of your system quicker.
And the taste smell issue too, and we had discussed this earlier, zinc, making sure your zinc level is optimized can probably help somewhat. And then for the neurological and the inflammatory processing, you may want to definitely consider your Omega Pros.
Yep.
And you can hit it heavy, as Amanda was talking to us earlier. Go ahead and hit it at 4 daily for a month, and then either back down to 1 to 2. I tend to be a 2 a day person, but some people can definitely get by with 1.
Yeah.
IV intravenous therapeutics can be really extremely helpful.
Yeah.
Just bringing your volumes back up, and that's available at our office too. So if you have any further questions, or we can be of further assistance, I want to thank you, Amanda.
Yeah, this is great.
For helping
really,
me do this series.
Yeah, wonderful that you're doing this for your patients. It's so helpful, and it helps explain things, and you're giving them an option of hearing you without having to have an appointment. I think this is wonderful what you're doing for your patients. So helpful.
Thank you. And any questions, go ahead and give us a call. I'm Dr. Bruce Sadlick, and it was Amanda Safer, functional medicine consultant, and we're more than happy to help you. Thank you.